Hello, everyone. My name is Chris Black, and I work in the communications department at the World Health Organization in Geneva. And I'm coming to you live from our headquarters here in Geneva, Switzerland. And we're so pleased to bring you a special live event on all our social media channels on the very important topic of lead poisoning prevention. Even though there's wide recognition of the harmful effects of lead, and many countries have taken action on this issue around the world, it still remains a key concern to healthcare providers and public health officials. An important source of lead exposure, particularly in children, is paint containing high levels of lead. These paints are widely available in many countries and are used in homes and schools and playground equipment, even though there are good alternative paints without any lead. So, marking International Lead Poisoning Prevention Week, we're joined today by our expert on this issue, Carolyn Vickers. Thank you so much for joining us, Caroline. You are a chemical safety and health expert at the World Health Organization, and I'm wondering if you could tell us a little bit more about the campaign and its objectives.
Thanks very much, Chris, and hello, everyone. So the week this week is to draw attention to the health impacts of lead and the work that countries are doing to address that, and also what needs to be done to further address the problem. And Chris, you mentioned lead paint. Well, in fact, 77 countries have taken action to address lead paint, which is one of the key causes of childhood lead poisoning worldwide. So that's good news that these countries have taken action. But on the other side of the coin, it means that about 60% of countries have yet to take that step. So the week is to provide increased awareness about the issue, to explain the resources that are available for people to address it, and so that there's an appointment, or if you like, an event, so that people everywhere in the world, at local, national, and international level, can mark this week by undertaking events, activities, having meetings, talking to people to raise awareness about the problem.
5th, I believe, and it ends on the 31st. So it's still a few days more for people to become active on this issue. Could you tell our audience what impact does lead have on people's health?
Lead is a terrible toxin. So it's a chemical that's widespread in the world because it's actually naturally occurring in the Earth's crust. But when there's human activity that releases it, then it becomes available to people. People can be exposed to it. And so the effects that it have are firstly on children, particularly on the developing brain and nervous system. So both young children, but also the fetus when the fetus is developing. And the effects that it has in this case are it affects IQ, reduced education attainment. So if you like, it's one of those chemicals that people call the intellectual robbers, because it's taking from us our, the intellect and the brain power of our populations. The other thing is that in adults, it can have effects as well. So in adults, for example, workers that are exposed to paint, they're painting industrial sites, etc., or they're doing abatement work, they can be exposed to lead as well. And the effects that it has on adults are increased blood pressure, which can lead to stroke, which, as we know, is a leading cause of death in the world. And also it can affect the kidneys. So that's, in a nutshell, the main health effects for the two vulnerable groups, both children and for workers.
So if we're concentrating a bit on children, let's say, there's different ways that they would become, they could be influenced by things with lead. So we've got paint and we've got toys, I believe. So how can a parent protect their children from lead paint poisoning?
So I think the first thing is to be a careful consumer. So if you're buying paint and you're going to be painting a nursery, for example, or you're renovating the house, check that it doesn't have lead. You can check whether your country allows lead. You can look up the WHO website, ask a local authority, or you can make sure when you buy paint from your local seller that it doesn't contain lead. Then if you are, for example, you're involved in changing a car battery, you can make sure that the car battery goes back to the person that sold it to you, to the retailer, because car batteries can also, they also contain lead. when they get into situation of being not well recycled, they can release lead into the environment. The other thing too, I think, is that when you're involved in activities, local activities like at your school, they're choosing equipment, or they're thinking about doing some renovations, you can make sure that the local policy is to use lead-free paint. So there are some of the things that people can do. Oh, I should also mention, which is very topical for people at the moment, is to make sure that the kids wash their hands before they sit down to dinner. Because if it so happens that there was lead paint put in your house many, many years ago, the dust comes gradually from the walls, it gets on the floor, the kids crawl around, they put their hands in their mouths, and this is another way that children can be exposed.
Is it a question of level of lead in the paint? So if, for example, something had been painted, I live in an old house that had been painted 50 years ago, is it still a problem? Or is it a question of exposure, or does it go away with time?
Yeah, that's a very good point, Chris, because it doesn't go away with time. It's there. And so it's very important when you're doing renovation that you check whether the house has been painted with lead paint, and you get advice from local authorities how to deal with that. Because lead gradually comes away, especially if the paint is peeling or flaking, and then it gets in the household dust. And as I said, the kids will get it into their system. And the problem with lead is that in this situation, it's exposure over many years that gradually builds up, and the effects that it has are irreversible. So it's an important issue to address.
Very good point. So again, if people are joining us a little bit late, we're a special live event with WHO's expert on lead poisoning prevention, and this is for International Lead Poisoning Prevention Week. We have a question from one of our viewers. Is wondering, is on a label, if, for example, on a can of paint, will it say that there is lead or no lead in the paint? Is that something that countries indicate to consumers?
They should, so that the lead is added to the paint, and there should be ingredients that list that. If they're not, I think the wisest thing to do is not to buy that paint, and to look for another place where you can buy the paint that lists the ingredients, and also to draw attention to the fact that the label doesn't have the right ingredients listing on it to the seller, and say you want to have paint which is properly labeled, otherwise you won't buy it.
We have a question from Facebook. Thank you so much, from Pura Nanda. And they're telling us, could you give us some examples of the signs and symptoms of lead poisoning, please?
Yeah, that's a very good question, because if you have very low levels of lead exposure, that still might be causing harm. There may not be any overt signs or symptoms. Some of the effects that result in children with long-term lead exposure, they're very subtle. So it might be antisocial behavior. It could be reduced attention, doing less well at school, and you don't know why that is. So that's why population screening programs are very helpful. Then once you get into higher levels of lead exposure, obviously you're seeing really frank effects. So you're seeing effects on the nervous system. You're seeing things, it can even lead to coma and death if you have very high exposure.
And we were talking about people buying products. What sort of things can businesses and civil society organizations do to address the problem? Are they involved in the week this week?
Yeah, they're really important, both in the whole work of the Global Alliance to Eliminate Lead Paint, which is a joint initiative of WHO and UNEP, United Nations Environment Programme, as well as involving partners from business, community service organizations, etc. So in this initiative, we've seen very active participation of the partners, so businesses, companies, and industry associations, proclaiming their policies for only selling lead-free paint, promoting the issue with the government, saying that we're ready, we don't need to have lead paint, pass the law, and some companies are already doing it voluntarily. And then civil society organizations have been really supportive in reaching out at the local community level to make sure that people have information, including in the local community languages, and are aware of the issues. So I think there are some of the ways that the industry and the community partners can participate.
As the entire world is being affected right now by the COVID-19 pandemic, is that something that's had a factor in terms of either the work against lead poisoning, or in fact against the issue at all? Is that something that's on our radar on this issue?
Well, certainly we are very occupied with the issue of COVID-19, both as an individual when you read the news or you see the news, and also health workers, quite rightly, very involved in the issue and spending a lot of time on it. But we have found that although it's impeded some actions in some countries, so health workers are occupied elsewhere, in other places, countries have managed to pass laws, and recently some countries have done so. So it depends on the situation in your country. And also we're not occupied with COVID-19, most of us 100% of the time. So at these other times, we are proceeding with the work to support countries to regulate lead paint. And I think that, of course, the pandemic will pass, and it's important that we've kept the awareness up about the issue, so that when people are moving now to turn some resources back to other issues, that the issue of lead poisoning is there and can be well addressed.
We're getting many questions in, so thank you everyone for writing there. Don't hesitate to tell us what country you're coming from and where you're watching us today, and if you have any stories or questions, just throw them in the comments section. If you're on Twitter, it's hashtag AskWHO. We're getting a question about what is WHO doing to support countries banning lead paint? Yeah,
that's a good question, because we've been working on the issue for a while. And so what we've learned from that experience is that there's three main things that people need. Firstly, they need to know about the problem. So what are the health impacts? Why should we do something about lead paint? Why is it important compared to the other priorities that I have? So ministries of health need the arguments for that to convince the other organizations that also need to participate in the decision-making to pass the laws. They also need to know how. So it's not enough just to know the problem. You need to have some solutions. And, there are many countries in the world, and each country doesn't need to find their own solution. We can learn from each other. So sharing information about how to address the problem is the second main issue. And WHO has released some reports this year which describe why and how to take action. Then the third thing is having the means to take action. So you may know about the problem, you may know what the law needs to look like that you want to pass, but then you need the resources to do so. So WHO and UNEP are leading a project at the moment where we're supporting 40 additional countries to pass lead laws. We're providing a model lead law so that people, as I said before, they don't have to discover themselves how to write such a law. We're providing tools like how to measure lead in blood, what's the best way of measuring lead in paint. And we're also developing guidelines on the clinical management of lead poisoning. So at what level should what actions be taken if you have a population or a child that needs attention for this issue. So they're just some of the things that we're doing. And also the campaign.
Excellent, the campaign, very important. So if you're joining us, we're talking about the lead poisoning and health during the International Week on Lead Poisoning Prevention. And the questions are flowing in, so I'm going to hit you up with a few more. Let's go over to LinkedIn. And something I was wondering as well, how do you remove lead then? Let's say you've bought an old house, walls, or have lead paint on them. What do you do? How do you remove that safely and then dispose of it?
Okay, so the first thing is you don't do it yourself. So you go and ask your local authority, council, etc., for some advice on the issue. And so they will usually have some guidance about how this should be done safely. They can come and test the house for lead paint. The household test kits are not very reliable, so it's good to get a professional to do it. And then they can come and remove the lead. They need to wear protective equipment, etc. You need to leave the house at the time. They need to clean up properly afterwards. They use particular methods to make sure that the dust is kept down. So basically, this is one thing where you don't do it yourself. You ask for professional help.
Thank you, Karen. Let's see. Are there countries? You mentioned that at the very beginning, you were talking about the percentage of countries that have banned lead products and those that haven't. Are there parts of the world where it's much more of a problem, or is it really it's a universal problem in terms of the countries that haven't taken action yet?
Okay, well, if you look at the WHO regions of the world, even in the developed country regions, there are some countries which have not yet taken this step. But it's true to say that in the less resourced countries, the developing countries, particularly in Africa, some of the Asian countries, they still need more work to be done, more support, so that they can also regulate lead paint.
You know, one thing we maybe didn't talk about is why would you ever have put lead in paint? What was the purpose of putting lead in paint? What is it used for?
Okay, so it's in the pigments. So this is the colorant for the lead, and also in something called a dryer that helps the paint dry more easily. But these products are not necessary. You can get pigments that have very, very low levels of lead that are just like natural background levels because it's in the soil. And you can use dryers that don't have lead.
Paints that don't have lead, are they manufactured that way and they're the same
Yes.
cost? Are they more expensive? Is there any advantage or disadvantage? Excellent, excellent.
Yeah.
We have a question from Facebook from Chica Ella, and they're asking, is lead sometimes appearing in tap water from perhaps from plumbing, from solders and the pipes and things like that?
Yeah, that's true. And so it's important to make sure that these pipes, which are just the ones in the house, are removed and replaced with lead-free. And if you do, of course, have that situation in the interim period, you make sure that you drink cold water, not hot. Or if you're drinking water, perhaps get bottled water. And also, again, speak to the local authorities about the situation, the water provision authorities.
You were mentioning the tests that can be used for testing the paint on the wall. If someone has potentially lead exposure, are there tests then for seeing the level of the exposure in the person, or how is that acknowledged?
Sure. Well, if you have this worry, go and see a local healthcare provider, and they will take a very small amount of blood and they will test it. So it's a blood test. It can be just a fingerprint.
Excellent. Thank you, Carolyn. And we have a question from another Caroline Riley, and she's saying there should be a global ban on lead paint being produced and sold. That's what our work is moving towards on this issue. Is that correct?
Yeah, that's correct. In this case, there isn't a globally legally binding treaty that binds all countries. However, countries did pledge to address this issue, and so we're following up to make good on that promise, to support them to take the action at local level to ban lead paint. And I should say that even if there was an international treaty, that doesn't actually make it law in the country. The countries do still have to make the law themselves.
Perhaps we could talk a little bit more about the activities this week. I'm sure you've got lots of things happening around the world. I'm wondering if you could talk a little bit about stories you're hearing from our partners and from what WHO is doing to highlight this important issue during the week.
Okay, good. Thanks a lot, Chris. Yeah, so we've heard the other day about some people who've doing awareness raising in India. They're driving around the country in a van to take the issue to the people and speak to them about what they're doing. Every year we have a lot of events in schools. So it's raising the awareness with kids at while they're still learning in the school situation about these issues, is the best time to educate people about these issues. We've found at another level that governments take this moment to organise an interministerial meeting. So they will get together their colleagues in the other ministries to talk about what they're going to do to address the problem. I think one of the issues with lead paint regulation is that we shouldn't jump to the conclusion that somebody knows it's their job. That's not necessarily the case. So in some countries, we find that the health ministries pass the laws. In other countries, we find it's the environment ministries. In some cases, it's the standards authority. So people need to get together and sort out who's going to do what. So that's another very helpful activity that's happening this week in some countries.
Is there still lead used in gasoline around the world? Is that still an issue? So again, talk to your point about different agencies. It could be the transport industry then and the Ministry of Transport. Or is it less an issue now?
Well, that's a big success story, in fact, and it shows that addressing lead, sources of lead can significantly lead to reductions in lead exposure, which that has done, getting rid of lead in gasoline. UNEP keeps the statistics on that, and the last report was that there was only one country which is still using that leaded gasoline. So that's a great success story, and we hope, within a very short period of time, as short as possible, that we'll be able to say that getting rid of lead paint is another success story.
Indeed, let's think of that encouragement. So going back to our questions from our audience, thank you everyone for asking these questions. We really do appreciate your contributions. One of our viewers is wondering, in terms of paint, how does the exposure get into our bodies? Is it by touch? Is it through the nose, by breathing it in? Is it, like you said, if eating it, if kids are playing with walls or whatever? So what is the route of the lead into our bodies?
Okay, so there's two routes. The first one is by ingestion. So it can be the dust, as I mentioned before, or there could be contamination in the food. For example, if you have some pottery which has lead glaze and you're repeatedly using it, the lead can come out of the glaze and into the food. And Chris, as you mentioned before, the source can get into drinking water. Then the other route is inhalation, and of course that's the dust again.
We have a question on the same topic from Facebook. So children that have been exposed to lead, can they recover? And then what would be their long-term risks? You mentioned this a little bit earlier, but maybe we can go into a little bit more detail on that.
Yes, so if a child has been very severely poisoned with lead, so there have been some very serious outbreaks of lead poisoning in some parts of the world, which have led to children being highly intoxicated, very high exposure levels. That can be treated by chelation therapy. It's a therapy that's given to take the lead out of the blood. But then in most cases with low level exposure, the issue is, I should say that when they have had that severe exposure, then the very frank, obvious neurological effects will get less, but they will probably have some long-term ongoing damage as a result of that. But then the low level lead exposure, the primary action is not to necessarily chelation therapy, that's only above a certain level. The main issue would be to make sure that you identify the source of lead and remove that exposure. Because as I said before, when there's been many years of low level exposure, these effects on the nervous system are unfortunately, they're not reversible.
Thank you, Carolyn. So again, if you're joining us a little bit late, we're talking about lead poisoning and health during the International Week of Lead Poisoning Prevention. We've got a question from Facebook. What's the role for environmental health officers or inspectors in contributing towards awareness on this issue? Is this a group that WHO works with or works with through our member states?
Yes, it's an important group at the local level. We primarily work with ministries of health, and obviously environment officers can also be in the ministries of environment, often at maybe not national level, can be state or even local level. And yes, they do play a very important role to play because, on the one hand, the health professionals will know very well about the health aspects, but it's important to work with colleagues who are experienced in the environmental aspects, so know about the sources of lead, how to address them when you find it. So often we find this is a very good way to address the problem for health and environment officials to work together.
Are there any other good examples of awareness raising that's going on in terms of using, social media stars, influencers, or musicians? Are there any initiatives on that side of things?
Yeah, we do find that in recent years there's been a lot more interest in social media. We do get a lot of media reports, not only social media, but also in the traditional media, the newsprint, etc., and on TV. Yeah.
Excellent. So perhaps as we go towards the end of our show, we're just going to go back to the beginning. So for those that have missed it, if you could tell us a little bit about this important week. So lead poisoning. Why is it? Why is it a problem? Where is it a problem? And what do people need to do about it?
Okay, so yeah, thanks very much for participating today in the session. And as Chris said, to come back to the beginning, unfortunately, lead poisoning remains a serious concern for children worldwide that needs to be addressed. Lead exposure is entirely preventable. So we need to take action to remove lead from paint and make sure we're addressing the other sources of exposure, such as batteries, etc. It's great that people can participate in the campaign this week, which aims to raise awareness about the health impacts, what can be done about it, and to promote further action. And just to recap on the health impacts are significant, they're long-term. We're talking about impacts on the developing brain and nervous system, impacts particularly on children that are long-term and irreversible. So it's a really important task that we have. And so lead exposure, as I said, is preventable. And the solution for lead paint is to ban lead paint and switch to alternatives.
And we're going to sneak in one extra question from one of our regular contributors from Canada. And he's asking, how difficult is it to remove lead paint from older buildings? And does it require experts and trained professionals for that work?
Yes, it does. You shouldn't aim to do this yourself because it could lead to exposure, and you need to have the right protective equipment and methods. And it does need to be done with care. In the household situation, it's a manageable task. And there are also some big issues that governments and local authorities have had to address because they have had some very big structures that they've had to remove lead paint from. For example, the Sydney Harbour Bridge. For many, many years, this was being painted every single day continually with lead paint because obviously the paint deteriorates. And the government needed to address that. So when people were taking the lead paint off that building and off that bridge and replacing it with lead-free paint, it was a massive exercise. But the government did it, and now the problem has gone away.
Maybe you could just sum up a little bit about how the partners WHO works with on this initiative. Who would we like to give a shout out to during this important week?
Yeah, sure. Thanks very much. Yeah, so we work very closely with the United Nations Environment Programme. As I said before, the marriage between health and environment is a very important one to achieve action. We're working with a number of countries who are participating in the Global Alliance to Eliminate Lead Paint, as well as industry associations at the international level and regional level. And also with our partners, the International POPs Elimination Network, IPEN has been a very important partner in working in a number of countries to support the national and local action. And I have to say also that I can't mention all of the partners in the Global Alliance to Eliminate Lead Paint. I wish I could, but there's more than 100. So thanks to all of you for the campaigns that you're running this week and support for the issue. Very much appreciated.
Thanks to you. Where can people learn more about this issue? Is it on our website? Is there a specific place they can find information?
Sure, it is. So go to the WHO website. There's a campaign webpage where you can find all of the materials and including information about the situation in your country. That's there as well.
The week wraps up on the 31st of October, and more information then on www.who.int. We've had people from all around the world. This has been so nice to see, from Cameroon, Serbia, USA, India, Finland, Saudi Arabia, Greece, Denmark, Colombia, Sudan, Nepal, Indonesia, Canada, Uganda, Kenya, Pakistan, Bangladesh, Mexico, Burkina Faso, Gambia, Uzbekistan, Sweden, the United Kingdom, Brazil, Lebanon, Indonesia, Myanmar, France, Tunisia, Iran, Turkey, Mozambique, Tajikistan, and here we are in Switzerland. Thanking you so much for joining us today. Thank you, Carolyn Vickers, for your time and for raising this important issue on social media with us. If you have any more questions and you're not watching this and we're live, just put them in the comment box and our social media colleagues will get back to you. We hope you can join us soon for another one of our live social media events. There's something coming up tomorrow for World Cities Day, so please join us for that if you can, and we look forward to that. And thank you again for joining us. Have a good day, everyone.